We'll just wait a few minutes for folks to join us. We have Dr. Eve Creep here joining us today. We're so excited to have you. We'll just wait a few minutes for folks to join in so they don't miss all of your important tips.
Sounds good.
Okay. Should monitor see. Okay, we have 6 people already joining us, and the number's starting to tick up. So thank you, everyone who's tuning in to view us tonight. We are here with Dr. Eve Creep, who is an amazing pediatrician in the Huntington area. We're just going to sit tight for another minute or so and let a few others log in, and then we'll begin. All right. Another minute or so. Well, I want to share with you, Dr. Creef, that you have an admirer who said, "You rock, Dr. Creef."
Thanks.
We know. We're so excited to have her here. Okay. Just wait one more minute because we were a little late getting started. All your fans are starting to tune in. Okay. Okay, we're going to wait a few more seconds and then we're going to get going. That's okay. Okay, I guess at this point we will get started, and those who want to join in later can join. This will also be a live video on our page, so if you've missed it, you can certainly join in and rewatch. We are here tonight with Dr. Eve Creef from the Huntington area. She's based out there. She's a pediatrician, has a wonderful following of patients. She's on the executive committee of the Long Island, Brooklyn, Queens chapter of the American Academy of Pediatrics, where she serves as the legislative advocacy chair. She has been an outspoken advocate in recent years, organizing rallies to save the ACA from repeal, oppose abortion bans, and most notably to oppose family separation and the inhumane treatment of immigrants at the southern border. And I've been fortunate to be able to attend some of those rallies. So thank you, Dr. Creef, for organizing them. She's on the national core team of Immigrant Justice Now, and she was recognized as the Woman of Distinction for Suffolk County's 18th Legislative District in 2018, and she received the American Academy of Pediatrics Outstanding Achievement Award in 2019 and a New York State Senate Commendation Award in 2019. She also was recently honored at the National Organization for Women's State Conference for her outstanding achievement on Long Island. So we're thrilled to have her with us tonight. I know that these are, can be anxiety-inducing times. This is, we haven't dealt with this before in our lifetime. So it's really wonderful to be able to bring an expert right to all of you to answer all of your questions. So Dr. Eve, I'd love for you to just say a few words and say hello to everyone.
Hi, everybody. Thank you for coming on, and thank you so much for having me. Just really happy to be able to be here to answer your questions, and everybody has a lot of them right now. As you say, these are really anxiety-ridden times for all of us. Before we start, I think it's really important that people understand what we mean when we say flattening the curve.
Mhm.
So flattening the curve means to slow the rate of rise of infection, right? When a curve is going that way, cases are rising exponentially, right? We're seeing, like we're seeing right now in New York, there's just many cases, many more cases rising every single day. And we want to just kind of flatten that curve as much as we can, or just slow it down. So we're just decreasing the rate of rise, just so we decrease the burden on our healthcare system. What is also important to realize is that we're all going to get, or most of us, I should say, are going to get this virus, right? Like 40 to 70 to 80% of the population will get this virus because this is a new virus to the human species. The only way to be immune to a virus is to have antibodies against it, and none of us have antibodies against this virus because it's new. So the good news is that when most of us come into contact with this virus, we'll be fine. We will have no symptoms, or we'll have mild cold-like symptoms. Some of us will have a flu-like illness, a mild flu-like illness, and some of us will have a major flu, and some of us will get really sick from it, with the majority of those being, as we've heard, the elderly, the immunocompromised, and those with underlying health conditions like diabetes and cardiovascular disease. So what's going to happen, though, even though the rate of hospitalization and the death rate increases with age, we're also seeing a lot of really sick people in their 20s, 30s, and 40s. Nearly half of those that are hospitalized are in that age group. They're just more likely to survive if they can get the ventilators that they need, right? So what we want to avoid is having all those people in that age group and the others that need ventilators, that we would probably be able to save their lives, and we just can't because we don't have the ventilators to put them on. Because if you're on a ventilator, it's not just for a few days, but sometimes it's several weeks that you really need to be on this ventilator until your lungs are healed. So if the hospital system is inundated with all of these cases coming that need hospitalization and ventilator support, we're going to be overwhelmed. We're not going to be able to save lives that we otherwise would be able to. So the idea behind flattening the curve is to save lives, right? The slower rate of rise, the more lives we can save. And the way to do that is to stay at home. You've seen that hashtag everywhere, stay home. And it really will make all the difference. That's the only way we have to flatten the curve and to save lives.
Thank you so much. You mentioned something that I think is really important. I think a lot of us are staying home, and there is this misconception that younger people cannot get it, or children cannot get it, or it's not dangerous for children. And I think what we've seen is, and maybe less so this week than end of last week, but children were still having play dates, children were still visiting neighbors. And I think we're starting to see young, unfortunately, young adults are passing away with the disease. But I wonder if you could talk a little bit about how dangerous is it for children to be playing together or visiting neighbors or potentially family members?
Right. So the thing with children is that one of the brighter sides of this whole thing is that our children are really not getting seriously sick from it. If you look at all the data from Wuhan, China, only one child of all those deaths, only one child died, right? So children can't get sick. They might get very sick, but they're not going to die from it. Most children are really not going to get sick, and most will be asymptomatic or just get colds or carriers when they're infected. But the reason that it's so important to keep children apart is because they're a huge source of vectors, as are asymptomatic young adults. So even though they feel fine, or they have a little cold or sniffles, or again, feel completely fine, you could be giving this virus to somebody else very easily, particularly children who are all over each other, in each other's faces, and sneezing and coughing and wiping their noses and touching their face. And we know about that, little kids. So, we really want to keep them apart. So, there was a lot of hubbub last week because a lot of people were still, they said New York City, oh, the parks are open, go to the park. And a lot of parents understood that to mean that you can go to the playground. And you should not go to the playground because, kids are touching shared surfaces. They go up to each other. So playgrounds are definitely a no-no. And as are play dates, because when you have a play date with another child, you're not just exposing your family to that child, but you're exposing your child to your child and your family to that child's family, and to everybody that that family's been in contact with, right, for the last 2 weeks, whether they were asymptomatic or not. What I'm telling all my patients and parents is that we all have to assume and act as if we all are carrying it. We've been exposed to it, we're carriers, or that we have it if we have sniffles or a cold or worse.
And even if we don't, potentially.
Even if we don't, just act like you do. Act like you do.
Because we might, and the symptoms
we
just may not have
might.
presented yet.
Exactly.
I am getting some questions coming through from some of our viewers. So I have a long list, so hopefully we'll get to mine, but I'm going to really prioritize our viewers here. So the first question comes from Rachel. She says, Governor Cuomo made mention of asking the FDA for testing people who think they had it for the presence of antibodies. Have you heard any talk about this possibility or any idea of what a timeline might be like?
I'm not sure. It must be some kind of protocol that they have going out, specifically in our area on Long Island right now. We are really not testing, I deal with children, pediatrics, and we're not testing children. In fact, I know even at the pediatric emergency room at Cohen Children's Hospital, they're really not testing children because the adult side is just so inundated with really sick patients that they have to run these tests really quickly. So we just don't want there to be a backlog. Knowing that children aren't going to get really sick from it, we really want those tests to be able to come back quicker for adults and to be able to let everybody know what they have and to have the right protection for taking care of them. So I'm not sure about anybody testing.
You haven't heard about for adults. And I wonder even with the healthcare professionals, because you all are such heroes on the front lines, really fighting this pandemic for all of us. And we appreciate that. And thank you so much for that, for your courage and your bravery. But have you heard any talk about testing for antibodies for even healthcare professionals?
Not officially, no, not through my channels, but I'm sure there's multiple studies going on out there to really, the scientists are at this 24/7, just really trying to work hard to find a cure. So I'm sure there's multiple studies going on out there.
Right. Okay. All right. Thank you. Let's see. I'm going to ask, so many comments are coming in, which is fantastic. Give me 1 second to pull them up. Okay. Sarah asks, no one in her house has the virus or any symptoms. Can she hug her children?
Yes, because you're in the same household. So within the same household, you don't have to have that 6 foot, difference. And you know that you've been with your children for 2 weeks, so you know that none of you is symptomatic or has anything. So, if you should really just try and maintain your distance from other families, but just keep anything contained within your own household. So yes, you can hug your children.
And can you comment on that? There has been, I think, two sort of schools of thought, and there's been a lot of information coming at all of us at the same time, where there's a 3 foot distancing or a 6 foot distancing. My family has been operating on 6 feet. And so I would just love for you to explain to our viewers what you think is a safe distance, whether they're symptomatic or asymptomatic.
Right. So 6 feet is the safe distance. And when you do go out, because we encourage everybody to go out and get fresh air and exercise, but when you do so, just make sure you are distancing yourself 6 feet away from people. Because that's just the trajectory that if someone sneezes or coughs, could reach your eyes or your nose or your mouth and get infected that way, or get into a surface where if you touch it, you might get it. As far as, how long the virus survives, it can survive in air and respiratory droplets for 3 hours, mainly through sneezing and coughing. But from what I've read, it's unclear whether it survives in the actual air that you're breathing. So that's why I kind of like to walk through things quickly, not just 6 feet away, but if you're walking where someone else has walked, I kind of go through there pretty quick myself personally. Maybe I'm paranoid. But as far as surfaces, yeah.
I think you can't be too careful. So
exactly.
on actual surfaces, so I have read conflicting information that it lives on certain surfaces longer than on other surfaces.
It does. So it lives on cardboard that you might be getting like a delivery on for 24 hours. It lives on steel for 48 hours, and it lives on plastic for 3 days, for 72 hours.
Wow.
So that's why if you're getting home deliveries.
Can you repeat that one more time? Because I think that's really
Sure. It lives in the respiratory droplets for 3 hours. It lives on cardboard for 24 hours, on steel for 48 hours, and on plastic for 72 hours.
Wow. So would your recommendation be, I mean, there's a lot of folks that are having groceries delivered or running
Right,
out to the store to get either medications or
right.
groceries. Do you recommend that people wipe down their groceries with the Lysol wipe? And I guess, we always are supposed to wash our produce, but is there any guidance as to how long someone should be washing their produce
Yeah,
or
so I mean,
wiping down?
if there's non-perishable like stuff in there, maybe just leave it for a day, depending on what you've ordered, because then the
Okay.
box will be fine, right? If you need the stuff that's in there right away, yeah, I would just wipe everything down with Lysol wipes and not just the cardboard box itself, but the actual products.
Mhm.
Just because they were sitting on shelves and someone else might have touched them. I mean, it sounds really, a little OCD, but kind of have to do it. I do.
Sure.
Yeah, that's you'll really minimize the risk that way. And I do encourage home grocery delivery if you can do that, because being in supermarkets, even if you're distancing, just staying home is really just really crucial. I think it's
Right.
really the only way to stop this.
Yeah. And so what about something like produce, which is neither a cardboard nor a steel? Um, how does one go about, thoroughly making sure that is washed? Do you recommend just leaving it for a couple days before, wash it and then leave it? Or is there, I mean,
I
I know I'm
don't have
probably throwing
any,
it.
yeah, I don't have any information about produce. So I guess if you were to thoroughly wash it and leave it for a couple of days, if it wasn't that kind of item that needs to be eaten right away, that would
Mhm.
be great. And if you're able to get, maybe those sealed or packaged, salads and, fruits with, like oranges and bananas that can be
Mhm.
peeled up and things like that,
Okay. Just to be safe.
yeah,
Yeah.
yeah.
So grocery delivery, I've also heard, and I don't know if you've heard that there are some supermarkets that aren't set up for online delivery, that if you call the store and they'll tell you what they have, and then you can open your trunk and they'll just put it in your trunk. So you don't have to even go in the
Hmm.
store as well.
Yeah, I know that there's supermarkets that do that. The one near me used to do that, and they're not doing that now. But yeah, I'm sure some of them do have that
So those are
kind
the
of
better
option.
options rather than going into the store and potentially
Yeah,
yourself
yeah.
if it's
If you
possible.
have to, again, it's best to go. If you can get there really super early when no one else is there, and just keep
Mhm.
your distance from, people, and make sure to really, wash your hands and anything you touched in your car and your keys, things like that. Your keys are steel, right? So just anything that you touch, just make sure that you wipe down. Um,
Right, right. Okay, that's really helpful to know. And I'm just going to remind our viewers that you can enter any questions for Dr. Creep in our comments, and I will happily ask her for you. We do have a question. What advice would you give to folks who are not taking this seriously, and how would you describe to young folks, or how would you get through to young folks the importance of social distancing?
Yeah, so I think more and more of our high schoolers and college students in that age group are starting to understand,
Hmm.
um, the importance of the social distancing
Hmm.
as they're seeing the reports on TV. Just, I think it was really just last Friday, right, that we've just really started seeing this all of a sudden skyrocket. So I think that it is hitting home with a lot of people, at least here in New York. I can't speak for the rest of the country, but I
Hmm.
think, I'm seeing the towns a little less active than they had been, which was rather upsetting last week when I saw people out and about like nothing was
Hmm.
going on. Hence, we have just skyrocketing cases everywhere right now. But
Hmm.
I think that it is hitting home. And again, people just have to understand that, it's really just a social responsibility. What
Hmm.
they do can really impact other people. And for your older, teens, just, validate, their annoyance with all this. Just, it's, I mean, my daughter's a high school senior, and I know it's just, you got to feel bad for them. They're missing their senior year. And, you're really cutting off their social, a great part of their social life, and changing it for them. And it's just, it's just throwing a real wrench in their life right now. And so just validate that for them. But also just commend them for really doing what they're doing, and because they're the ones who really stand to spread this the most,
Right.
as they're carrying it asymptomatically. So they're really doing a tremendous service to the rest of the population by really, keeping their germs themselves, keeping their distance from their friends, and just doing everything they can to keep
Hmm.
everybody else safe. So
Right.
just thank them.
I love that you said that. Validate how they're feeling and then thank them. Because I also think the other side of it, and it's where we immediately go, is like, don't they understand that they're vectors, right? And I think it's important, like the way I've been operating is just to think about my grandma, right? Knowing that I would never want to infect my grandma. And
Exactly.
everybody has someone, or most people have someone that they don't want to infect, whether it's a friend or a family member. And it's really a community responsibility. But I think
Right.
That's so important to just validate.
And not just grandparents, but parents of that age group, can get sick. So yeah,
absolutely,
your whole family safe.
Absolutely. And because we're social distancing, and I know that there are a lot of folks signed on here tonight that have young kids or kids still in grade school or high school or middle school. And, the reality is if both parents get sick, like who takes care of those kids? So it's really, quite dangerous. So we really have to come together as a community and just stay home as much as we can and not be out. So,
yeah,
that's really important. Let me go to another question that someone had emailed to me to ask you. How long does this virus typically last? We've been hearing different reports as to when the symptoms present. And I know it can take up to 14 days, but is there an average time where symptoms are presenting, and then how long are they lasting, or does it really vary case to case?
Right. So the average time of presentation is between 4 and 10 days after exposure. As far as the presentation, how it presents, it really does vary from, again, asymptomatic to mild cold symptoms. Some people present with stomach symptoms like diarrhea, and some get, shortness of breath or tightness. Ultimately, if that's going to happen, it's usually the second week of illness, where you might have intermittent fevers and cold symptoms for a week, and then it's on the average day 7 to 9 that you start experiencing the more severe symptoms that you might need to seek medical attention for.
Okay.
So, yeah.
Okay.
And as far as how long it lasts, again, it really does vary anywhere from, again, no days at all if you're asymptomatic to a couple of days to sometimes intermittently for a couple of weeks we're seeing or more.
Right. What is the treatment for, actually this question is 2 parts. What is the treatment for children that contract COVID-19, and what is the treatment for adults? And obviously it depends. So if maybe you can kind of take us through what that would look like. If it's, cold symptoms, would we treat it like a regular cold? What does the more severe symptom, look like?
So there, aside for symptomatic care, which means fluids, Tylenol, rest, there is no treatment for either children or adults, which is why this virus is so concerning right now. There is no Tamiflu like we have for the flu. And there is no vaccine, as we know, yet. So we really have nothing in our arsenal right now, which is why there's so many ongoing studies to race and try and find a treatment and a vaccine for this virus. So we do have nothing, which is why people are getting so sick and staying sick for so long. It's just really oxygen. If they do get sick, they need oxygen support. And if they get really sick, they need those ventilators to help their lungs work. And just until the inflammation can resolve and they can get off the ventilator. But that's really the only treatment, just supportive care, fluids, oxygen. Yeah.
So more to that point as to why it's so important to stay home and social distance. The governor has been doing his daily briefings every day, and I'm sure many of us, I'm sure Dr. Kreef and many of our viewers tonight have heard that we are, not prepared. New York has half of the cases in America right now.
More than half. Apparently we have 30,000 and the next one is 2,000.
I think, it seems almost every few hours we get, quite a few more cases. As of this morning, we had 7,000 ventilators. We need 30. Last week, we needed 110,000 hospital beds. Now it's up to 140,000. So we're seeing this progression of this disease very quickly. And I think it's really important to share those facts and make sure that people know how serious this is, know that we can get through it, but know that it is very serious and we really need to come together as a community to protect all of us.
Absolutely. We're all responsible for each other right now. We have to be.
Yeah. And for all the frontline healthcare workers, I think.
Yeah, you're not going to see that hashtag stay at home from more than from doctors. They're posting that everywhere. Just they're begging people to stay at home. Really begging
Right. And the other thing is like, if you're saying that, which is true, of course, there is no vaccine right now. And the only treatment is supportive care. And those that can give supportive care are our healthcare workers. There are doctors, there are nurses. So it's important that the rest of us stay home and try to keep them as healthy as possible.
Right.
I do have a couple more questions coming in. Roberta says, I heard that you shouldn't take Advil or Motrin if you have COVID-19. Is that true? And if so, can you please elaborate?
So there were some case reports out of France that noted some links between worsening of symptoms and ibuprofen. Those are just really anecdotal. There's no real, case control study that confirms that. But I think out of just extreme caution, we're just not giving it and recommending that you not take it if you do have, COVID-like symptoms.
Sure.
Yeah.
Okay, that's really helpful.
Overabundance of caution, really, but nothing concrete that proves it.
There are no studies that prove it. Okay, so Nicole writes, so many people are now finding out that they have possibly been exposed by someone who has tested positive. How long after that exposure should you quarantine for?
So quarantine is when you yourself have tested positive. Self-isolate, we call it, when you've been exposed to somebody who might have it, have not yet tested positive yourself. Either way, you're acting the same. If you're self-isolating, you just stay in your room and everybody brings you your food and the rest of the household stays away from you and you really don't leave your room. If possible in your household, if you have a bathroom that you can use yourself, that's not shared, that will be ideal. Otherwise, you really want to wipe any shared surfaces very, very well with disinfectants. And it's just really important that you do not venture outside of your home, but, hopefully not your room either, if you haven't really been with your family much before that, just so, they're not exposed to. But definitely don't be outside. Yeah.
Yeah. Okay.
For 2 weeks, 2 full weeks.
Okay, so 14 days. You heard it from the doc.
Right, that's how long it could take the symptoms to appear. Again, an average of 4 to 10 days from exposure, but it could be up to 2 weeks, which is why we want people to self-isolate for that time period.
Do you know of any children that have become severely ill from COVID-19?
I believe there's maybe one child that I heard was in the intensive care unit, just one out of all these, compared to the, many, many adults that we have. So children just really not getting seriously sick from it. They're just not. Okay.
And have you heard anything about the use of nebulizers with children? Does that exacerbate? Does it help? Does it hurt?
Right. So it's not going to exacerbate the virus, but it makes it more infectious to other people, because when you give a nebulizer treatment, you're sort of aerosolizing the virus. So it's going to be in the air, and anyone that's exposed to that air is going to be more likely to contract it. So definitely if your child, if you have a young baby, and there's no other way to give the nebulizer treatment, then you're going to have to do that. Or a child that's just not compliant with an inhaler and an air chamber. But if you can use an inhaler and air chamber, if it's definitely, especially if that child has any symptoms, although we know that you can, have no symptoms and be a carrier, you should use an inhaler if you can.
Okay.
Just to prevent the rest of the household from getting it.
Okay. And what about steroids? I'm assuming if you're saying they can use an inhaler, then steroids would be okay?
Yeah, steroids are fine. They've not been shown to exacerbate the illness.
Okay, great. Can you give us an update on the testing situation? We heard Donald Trump last week say anyone who wants to get tested can get tested. But we know that is not happening in reality. The last I heard, there were still very finite criteria. You needed to have direct exposure to someone who has been tested and is positive, or you had to travel to China or Italy and be exhibiting symptoms. So I think, while New York might be testing or increasing their testing ability, we still know that there are a lot of folks who are presenting with those symptoms that cannot get a test. So have you heard anything?
Yeah, I think a lot of that right now is a function of how rapidly we're seeing cases rise right now. So I think more of the test kits are coming out and more of these test sites are opening. But right now we're, at least here in Suffolk County, and I believe in Nassau too, we're really just prioritizing people that are really sick, that with impending hospitalization or already in hospital, or those that are immunocompromised and starting to show symptoms, or those with underlying medical conditions. those are the ones that really need to be prioritized with testing. It's not that maybe the tests aren't there, but that if we inundate the labs with all these tests on people that maybe feel a little sick and want to know if they have it or not, especially children, or young adults that might not necessarily get that sick from it. I'm just telling people, just assume that you have it, behave as if you have it, and let's not overload the labs when they really need to do urgent testing on people that are seriously sick. I think that's why the testing isn't as forthcoming as it might be, and that's why there's such criteria with when you call to make an appointment.
Okay.
Yeah.
I think one of the things that I'm seeing is that there are many people presenting with symptoms that feel like a bad flu, and the symptoms are fairly common, right? To either flu or cold. So if you catch the flu or the cold, of course, I think all of our minds goes to, we have COVID-19, and then there's a little bit of panic-induced situation because nobody wants to find themselves with acute respiratory illness, right? So in that situation, am I correct to interpret from what you said earlier that person should self-isolate and take Tylenol fluids and rest?
Exactly. And, if you're concerned about your symptoms, definitely call your doctor. Most doctors right now have telemedicine where they can see their patients virtually. And me as a pediatrician, it's really helpful for me to just be able to get an eyeball on my patients, and I can see if they're happy or if they seem like they're really fussy, or if I can look at their breathing and look at their chest movement. So you can really tell a lot just by looking at a child when they call in, even more than a phone call. So a lot of doctors' offices are setting that up. Some of us have it in place already, and others are getting that ability now. Hopefully internists are getting that as well, with their populations being the more likely to get sick. But
and you have this set up currently, Dr. Creep?
We do have this in our office, and it's working great. But we just, if at all possible, don't go to your doctor. Your doctor can, call your doctor, see if they'll do virtual visits. I know that they've sort of waived HIPAA precautions right now, so that you can even speak to your doctor if he doesn't have a telemedicine program set up yet. You can actually see your doctor by FaceTime. That's allowed. So, or Zoom. So, try and speak to your doctor first, and if they're concerned about you, they will recommend testing. One thing they might do short of COVID testing to not back up that system is to check you for the flu, right? If you have the flu, you're much less likely to have COVID-19 as well, and that would be a bit of a relief to know that you have that and not coronavirus. So that's one thing they could do to maybe allay your fears a little bit, although we are seeing the flu season kind of taper off a little bit right now, which is less likely. But always speak to your doctor if you have concerning symptoms. So they can either put your mind at rest or suggest seeing you. We're seeing patients, again, we don't want to even see them in our office. We're really trying to see them in our parking lot. We'll go out to their cars. We'll put on our gowns and masks, and we'll check them out there. We just don't want, them coming into an office setting where they're going
to flatten the curve.
Yes, exactly. Or they're going to not be able to maintain that 6 foot distance from.
Right. We have some questions coming in, Dr. Kreef, for those who are looking to maybe strengthen their immune system to do everything that they can. And I presume that these folks asking this question are staying at home. They are socially distancing, but they're asking about ways to boost the immune system, both in their children and for themselves. Is elderberry syrup something that you would recommend in the absence of fresh fruit with antioxidants?
It's nothing that's been proven to help with this virus. I think the best way to maintain your immune system's health is to make sure that you're getting enough sleep, to try and put yourself on a regular schedule, to decrease anxiety, to get fresh air and exercise, and to make sure that you're eating healthy. And that's the very best thing that you can do for your body. Healthy meals and rest. Fresh air.
A little bit of exercise, right?
Yes.
So it sounds like a preventive health recipe. I love it.
Exactly.
I love it. Okay. Just as a reminder, again, for those of you who may have joined us a little bit later, you can ask any question you want right now in the Facebook comments, and I will ask them directly to Dr. Creek for you. Okay. We have a question from Josh. Does environment affect a person's outcome? Desert versus mountain versus urban, or does it not matter?
I would imagine, the outcome, not necessarily. If you have it, and it depends. I think we're still trying to see why people react the way they do. We're not sure. I think you're more likely to get it, obviously, in some settings, like urban settings where people are, were more on top of each other maybe a couple of weeks ago. You might be more likely to be seeing those symptoms now. Or if you were, in Florida on the beach, you're going to be more likely to see those symptoms now.
Right.
But hopefully with social distancing, it really wouldn't make a difference, where you live. And I think it's really just based, again, on age and underlying medical conditions that really affect outcome.
Okay. I don't know if this is an appropriate question for you, Dr. Kreef, but I'm going to give it a shot since one of our viewers wrote it in. Do you know if 3% hydrogen peroxide is an effective disinfectant? I don't know if that's outside the scope of your practice. We
No,
can try to Google that. We're not sure about that, Sarah. I'm sorry.
The alcohol-based solutions are what I've read that are recommended.
Right. Okay. All right. That's what I've heard as well. And then here's a bit of an administrative question. Someone's primary care physician got kicked off their insurance plan. So they're in between doctors at the moment. So if they end up with severe symptoms, do you recommend them calling an urgent care or calling a hospital if they don't have?
Don't call a hospital. Don't call a hospital because they're crazed right now. But yeah, call an urgent care center. I know that some of the urgent care centers have telehealth set up as well.
Okay.
Yeah.
That's really good to know.
Again, minimize going if you can help it. If you really don't feel like you're crazy sick, just don't go because you're going to be exposed to all the people that are there, and it's just not good.
Right. And Sarah, I will also let you know, I would also check with your insurance carrier. If you're still on an insurance carrier and your doctor got bounced out of your network, oftentimes insurance carriers do have telemedicine as part of the insurance plan. It's often not as, depending on your employer, it's not always marketed as well. It really depends, but your insurance company might have a telemedicine. You may be able to see a doctor sooner.
Do have that, yeah. Or just find a doctor in your plan because it's probably a good time to have a doctor. So ask around and get someone that's
maybe call someone just in case, and they might add you to the patient roster. That could, sometimes it can be difficult to get a doctor's appointment if you're a new patient, but that would be some solid advice, Dr. Kreef. All right, if anyone has additional questions, I'm going to see if I missed anything here. I think we got a lot of the questions. Sarah, you asked about inhalers. Dr. Kreef had mentioned that they're okay to use if you feel like it's helping you breathe. I guess it's helpful, right, from a supportive care perspective. Is that right, Dr. Kreef?
Yeah, I mean, if you're an asthmatic and you have a need for an inhaler, just use it as directed. Yeah.
Okay. See if I have any other questions here. You covered so much. Thank you so much. Let's see. I think you may have mentioned this, but because there has been many reports, I think the initial reports were that it was going to be only older people that this would severely infect, that they were the most at risk for severe symptoms. And while that may still be true, that they are a high risk population, can you talk about other populations that may also be high risk?
So the elderly, as you said, but also anyone that's immunocompromised, on immunosuppressant medication, individuals with diabetes or cardiovascular disease, they're going to be at higher risk.
Okay, so anyone with any kind of underlying condition or immunocompromised.
You're at high risk of needing to be hospitalized and getting very sick from it.
Okay, and do you think that oh gosh, I just forgot the question I was going to ask. So I just saw 3 other questions come in. It'll come back to me. Someone is asking, do we have any updates on PPE? We know that many of the frontline healthcare workers are in need of masks. They're in need of
desperate need. So at my office, we were lucky enough to have ordered some N95s during the measles outbreak because you need PPEs to protect against that. But we've been using the same N95. I've been using the same N95 in my office for 2.5 weeks now. So it's pretty nasty now, but that's all I've got. So that's what I've been using. And ordinarily, you're supposed to change that between every respiratory patient. And we have a surgical mask. Some of those that we'll cover it with to keep it somewhat protected. And that's basically what they're doing in hospitals as well. Like even in the emergency room setting, not just the outpatient setting like me, all they have is their 1N95 mask. And it really goes against all infection control protocols that we've ever been taught. But that's our situation right now. And it's, it's really rather infuriating for a lot of medical personnel out there right now that they are being sent on the front lines and exposing themselves to really putting their lives on the line, being exposed to this illness and coming home and exposing their families to it. It's really just unreal that we don't have enough of this, and that the government actually isn't enacting the Defense Production Act and get more of these masks produced for healthcare personnel that are on the front lines. It's just not good medicine. We're not only putting ourselves at risk, but the patient that we see next.
Right.
So it just, it's really just, we really need to get those. So if anybody has them out there, there's donation sites I know in Suffolk County, in Nassau County, and get them to us, get them to the hospitals, get them to the emergency rooms, get them to the ICUs. And I know that there's some pediatric offices in my area that don't even have N95s at all. They've been wearing surgical masks.
Right,
so,
right.
It's really not ideal.
Right. And someone has just written in about community members like going shopping with masks, but and that they should be available to healthcare workers, and they should, but it is possible that that person may have been exposed and needs to go get groceries, and so is wearing a mask so as not to infect others. Right?
If he's been exposed, then he should be self-isolating at home and not be in a supermarket. So if you have an N95, then you shouldn't be outdoors. So
yeah, it's unclear what type of mask it is, but
regular surgical mask, I guess, is,
right.
That's fine if you haven't had those. The ones that we really need for protection, that healthcare personnel need, are the N95s.
Okay. And unfortunately, we're in a situation where our governor is trying to secure more PPE, more ventilators, and quickly renovate spaces to create more room for hospital beds. But while he's been moving, fairly quickly throughout this process, our federal government is not. And it's really
inexplicable.
It is. It's inexplicable that, a president who is very used to taking liberties with his executive power has not enacted.
You're gritting my teeth right now.
The Defense Protection Act. I'm sorry if that was inappropriate to say to you, but to my viewers, there's just no reason for it. We have frontline healthcare professionals who are putting their lives at risk, who are there serving their community, doing what they've always done. They're the real heroes in this. And then frankly, if they all get infected, there's nobody to treat anyone else.
No, it was totally appropriate to say to me. In fact, the American Academy of Pediatrics put out an action call to all its members yesterday to post all over social media, to call their representatives, to post on Facebook. We need our PPE. This is the situation is really dire, and it's heartbreaking to really just.
And I will go ahead and post that action for all the viewers out there, and we'll put it out. We've been tweeting about it and putting messages about it. Please feel free to call my opponent and make sure he hears this message as well. Not just him, but every single representative in Long Island needs to hear it on the federal level for sure. And we can post that action because we want to make sure that you're safe. And we really, again, appreciate so much the work that you're doing. And thank you. Thanks for being here tonight, answering our questions. We do have a few more, if that's okay. Let's see. When you say the virus can be airborne, we're talking about the respiratory droplets.
Right.
Do we know if that means we could potentially walk into a room or a cloud of germs while taking a walk outside? Or do you think with the wind patterns, that's less worrisome than potentially like walking into an elevator?
Yeah, so being outdoors, it's much less of a chance than, closed in space like an elevator where there's just shared air in the room. Again, the respiratory droplets are going to be most contagious when it's through a sneeze because, in medical school, they showed us, what an actual respiratory droplet looks like and the trajectory and how far it can go. It goes really, really, really far, like 20 feet. Like it just it has a huge trajectory. So coughing and sneezing, that can get in your eyes, your nose, your mouth. And, that's serious. As far as living in the air that you walk into and breathe, I haven't seen, much on that, but to be safe, I would just avoid, going the same space for someone. has just been.
Sure. I think the fear was if you went for a walk with your family and someone had maybe
That's
walked
fine. It's the air. It's all just,
before, it's
yeah.
going to be dispersed. Okay, so
Yeah.
that's good to know, because we
Yeah.
have been seeing a lot of families getting out for some fresh
Which is great.
Yeah,
But just stay away from the other families. Like I noticed Melissa's would just wave from a distance.
absolutely. And I've been pleased to see that in my neighborhood, that, you know, people are being very respectful and walking to other sides. And but it's been nice, kind of that communal hello from the other side of the street.
Right.
That's great. Okay, let's see here. Should we worry about takeout and prepared food?
Well, you know, what I would do with the takeout is really speak to the restaurant beforehand and just find out what kind of infection control practices they're using. See if they're limiting, you know, their employees working if they're not feeling well. Maybe they should take their employees' temperatures, you know, before they come to work to make sure that they're well. To make sure that all the food is handled wearing gloves. And when you get it, I mean, if you're able to heat it up, you know, and if it's that kind of food we can heat up in the microwave, I would recommend doing that. And definitely just wipe down, you know, the box that it comes in and all that. So be careful with it. But yeah, I mean, if you can trust that the place is really just, you know, doing good infection control practices and you can wipe down that stuff or heat it up when it comes to your house, it should be okay.
Okay, that's good to know. Someone would like to know the issue of homemade masks, and there being a big push for folks to make homemade masks. Is that effective? Is it better than nothing? What's your opinion?
It's better than nothing. And it's really been heartwarming to see so much of the community want to do something and seize on that, realizing, you know, the deficiency that we have and wanting to help. Again, it's really the N95s that we need to be protective. We do want to cover those N95s with something that's going to be a barrier, since we have to use the N95 over and over again. We want to cover that with different things between patients. So yeah, I mean, those can be, you know, heated, I guess, when we get them. I think the hospitals have different protocols of what they're accepting and allowing to be used. So I would check with the hospital before embarking on that kind of, yeah.
Right. Okay. That's interesting. Yeah. I think there's so many people, particularly here in where we live in Long Island, in Queens, and in New York City, and Brooklyn, that want to be helpful. They want to do more, but it's really hard in these situations. So I'm going to ask you, Dr. Freak, if there are any calls to action that can be helpful from the public, definitely let us know. And we're happy to promote that out. A couple more questions here. Is transmission by water possible, whether in a body like a pool or in the rain?
In the rain, no, I can't.
Okay. And what about a pool? Or, I mean, I guess a jacuzzi wouldn't work because that's not social distancing.
No, and then the germs are going to be aerosolized that way. You know, I don't know. I haven't read anything about pools, actually. I wouldn't imagine that's a great thing to do.
Right.
You know?
So out of the abundance of caution, let's stay out of the pool.
I would. Yeah.
Yeah. Okay. Is there any chance of relapse, reinfection, or future concern for flu season, fall 2020, if vaccine and treatment are not found?
Right. So from what I've been reading, the virus does not seem to really be mutating. So that's good news, because it means that whatever vaccine they are able to come up with a year and a half from now, will still be treating the same virus. If this coronavirus behaves like the flu and other coronaviruses that cause the common cold, it might keep coming back every year. So by the time most of us have been exposed to it, we will have some protection. So if it does mutate, we'll get much less sick because we've been exposed to it before and have antibodies to a large part of its protein sequence, if that makes sense. So yeah, that was good news today, actually, that came out, that it is not really mutating. So we might be able to have an effective vaccine that will actually work when we need it and protect us in upcoming years.
That's great. That's really good news. Nice to hear some good news on this front. And is there a certain period of time that a disease or a virus would mutate, or could it still happen?
I think each virus is particular to itself, so it's not all of a sudden going to start,
Okay.
mutating. I think that we can
Okay.
rest assured for now. Just worry about the particular virus.
All right, I'm going to do another final call for any questions from the viewers. We have Dr. Creep here, who's a Huntington-based pediatrician, who's been answering questions for us for the past hour. We're so thankful for Dr. Creep's time and really just everything that you're doing for children in the community. I'm going to give wait another minute, see if anyone has any additional questions. But I just really want to thank you, Eve. I've known you in a different capacity than your capacity as a doctor, but I think it's just really incredible what you're doing, and it's really brave. And I know your husband's a doctor as well, and he's on the front line. So thank you so much from the bottom of my heart. I think from all of us, I can speak for everyone watching tonight. You really are a hero, and the community's behind you, and anything that you need, if there's anything we can do to help you, we will continue to hammer home the message: stay home, stay home, stay home, social distance, social distance.
I just want to give a shout out to all my colleagues that are in the emergency rooms and in the ICUs that are really on the front lines here. They're the ones that are just really seeing multiple patients a day and just really going through, it's got to be really emotionally trying as well. So, they're the real heroes right now. And I tip my hat to them, and I hope that we can give them everything that they need. I think we didn't also touch upon just how to deal with our younger children right now, who are probably going like really stir crazy. Nobody asked about that. So I sent you a couple of links that I think you're going to be posting on your page later, just with a lot of good resources and links to all kinds of things for kids to do. Yoga, and there's PBS Kids, and there's commonsensemedia.org. There's a lot of links for really good stuff for kids to be doing right now. If you can, it's a good idea with your school-age kids to start out each day with a plan, because things kind of tend to go all over the place. So we can just bring some sort of order to their lives. It'll be really comforting for them. So just every morning, just come up with a schedule, have them have some input in it, and make some time for learning, make some time for play, make some time for family time. Let them know when you're going to be available, because a lot of us are working from home. So just they have an expectation, understanding when you're going to be available and what their day is going to look like, and obviously healthy meals in there as well. And as far as emotional support for our children, our little toddlers and younger children, they kind of don't know what's going on. So, just give yourself a break when you can. Discipline tends to be a harder issue right now when you're not going out and about and don't have your regular routine. So, use your timeouts. They work, and they're important right now, because it's a baseline hard to discipline a 2-year-old, and much harder in times like these when you're stressed. So, and definitely take breaks for yourself and self-care if you need it. And for your older kids who might have questions, definitely address their fears and concerns and be honest and open with them. They'll be less anxious if they have the truth and understand what's going on, and reassure them that there are so many doctors that are working really hard to protect them. And for the teenagers, again, encourage them to sort of stay social with their friends. I think if there was any, bright side of all this is that A, it's a time of year when we can go outside and enjoy the outdoors, and B, that we do live in an age where we have so much social media and ability to connect with each other in so many ways. So encourage your children of all ages to do that. Encourage them to reach out to the other kids in their class that they know might not have had that kind of social outlet, and to reach out to them, make sure that they're okay. And as well use social media to reach out to grandparents that are isolated right now. And that'll make the grandchildren and grandparents feel really good to have that connection. So just a lot we could be doing with our kids. Don't be so crazy structured, and don't, worry if they don't stick to the school plan that you might be getting from your school. But have some kind of structure in there, where they're definitely going to be playing more video games than they normally do. And that's okay. It's okay to rely on that a little bit and have it be as a crutch, but try and, oversee a little bit what they're doing and try and get in there with them if you can.
Is there a particular messaging strategy that you would recommend for parents to talk to grade school children?
With reassurance. I mean, they might be hearing things on TV. Definitely don't have the TV on 24/7. It's going to be anxiety provoking for them.
Sure.
Ask them, pick up in their cues if they have any questions or concerns. Sometimes the younger kids are going to get more clingy or have separation issues, and just cue in on that and just try and answer their concerns and fears honestly.
That's great. Thank you
and
so
reassuringly.
much.
Yeah.
Thank you. And yes, Dr. Kreef did provide us with many, many links, which is great for us. I will be posting them in the comments of this particular video, which we will leave up on our page. We are also in the process of building out a COVID-19 resource page on our actual website, which I will also post. And I'm going to also list these resources from Dr. Kreef on that page as well. So I think we have no more questions. We had really covered a lot. So Dr. Kreef, thank you so much again for being here.
My pleasure. Thank you.
My gosh, I may have you back because I think things are changing all the time.
Absolutely.
If you'd like to come back, we'd love that. Are there any parting words aside from stay home that you would like to share?
Yeah, I mean, stay home, please stay home and stay safe. And again, I'm just telling everybody, assume that you are either carrying it, that you've been exposed to it, that you have it, and behave that way. And just social distance and stay home. That will work. It will work. If you're afraid, that's going to work. If you do that, if you stay home, you'll be okay. Just stay home until this is over.
Great. Thank you so much, Dr. Kreef. We will probably have her back if she'll come join us. Please, you stay safe, Dr. Kreef. And as I said, if there's anything that we can do, any calls to action, you need us to mobilize the community. We should be doing that and calling our federal representatives, really all of them, even if they're not your federal representative, and really pushing them to
enact the Defense Protection Act now.
Thank you. See, we're so aligned, finishing each other's sentences. Yes, this is so important. For those of you that may not know what it is, it's basically a power where our president could essentially force companies that manufacture dresses to manufacture masks and gowns to protect our healthcare workers on the front lines. So
and ventilators.
Important. And ventilators, exactly, which we really, really need here, and will likely across the country. It's hitting New York first, but we're starting to see already New Jersey's cases are going up, and it's happening in other cities as well.
And if they would self-isolate, then they wouldn't. They're going to be in the same pickle that we are 2 weeks from now if they don't self-isolate now. So it's a shame that messaging isn't going out to them.
Absolutely, absolutely. So we will be posting all of that information. Eve, you're such a beacon of light in these dark times. So thank you thank you, really. Thank you so much for being here, for sharing all that information. I think it really helps to hear the facts. It brings some calm to all of us, just knowing what we should be doing and what we shouldn't be doing, and hearing it from a professional like you. So thank you again.
Thank you.
All right, everyone. Thanks so much for joining us. As I said, I'll post the links, and we hope to see you soon. Thanks a lot. Take care. Bye, Dr. Kreef.